Kerala, a state situated on the tropical Malabar coast of southwestern India, is one of the most popular tourist destinations in the country. Named as one of the 10 paradises in the world by National Geographic Traveler, Kerala is famous especially for its ecotourism initiatives and beautiful backwaters. Its unique culture and traditions, coupled with its varied demography, have made Kerala one of the most popular tourist destinations in the world. Oh hey, I was just reading Kerala's Wikipedia entry, as one does. Did you know that Kerala was the first place in India to have the novel coronavirus? Yeah, that's true. It was also the first place which seems to have successfully controlled and contained the virus. How did they do it? Is it because of its world famous beaches, backwaters, mountain ranges, and wildlife sanctuaries? No, it's communism, baby! Let's do it! So, there has been a countrywide lockdown for over 3 weeks now. Is that right? I don't know. Time does not exist for me in quarantine. India has seemingly successfully slowed down the virus. The numbers are still growing, but at least it's not exponential. Silver lining, folks. In early March, there were 6 cases in India, of which 3 of them were in the southern state of Kerala. Now, Kerala is a very unique state because of its long history of communist-led government. This communist government has seemingly successfully flattened the curve, which is a gigantic achievement, not just in India but across the world. At the time of recording, they have 342 recovered people with 123 active cases with 4 deaths. These are excellent numbers. Let's take a look at our international friends and see how they're doing.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting. Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning, because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me.
Oof, that's rough. So, how does Kerala do it? I managed to get Dr. B. Iqbal on the show, who's a member of the Kerala State Planning Board. And I just want to stop here for a second and ask you to like, share, and subscribe because this was a very difficult interview to get. And I would really appreciate your support. All right, let's take a look. This is Rishwajit Singh on Left Click TV, and I'm delighted to have on the show today Dr. B. Iqbal. He is a public health activist, academic, and neurosurgeon. He's also been serving as a member of the Kerala State Planning Board since 2016. Dr. Iqbal, welcome to the show.
Happy to meet you. I'm happy to be with you.
So could you start by talking about the coronavirus situation in Kerala right now and how's it going there?
Now, you know that the first 3 cases of corona patients came to Kerala on 30th January, and then we detected corona infection in them, detained them. There were only very few contacts with them, and we thought that we are fairly safe. But it was only a beginning, as can be expected, because we have got a large number of expatriates from Kerala. And the next batch came in March. This was a few persons from Italy. And then, of course, from various parts of the world. And Kerala is one ethnic group which is all over the world, as you know, maybe next to Gujaratis.
Now, Kerala has a pretty good socioeconomic situation and a lot of skilled workers which regularly travel outside India. This made the state particularly vulnerable, but Kerala was also prepared.
You know that in 2018 we had this Nipah that happened in a small place in Calicut. And but that time, for the first time, Kerala people started talking about and understanding what is meant by an index case, what is meant by contact tracing, what is meant by quarantine, etc. Of course, this was a learning experience for us.
Mm-hmm. The novel coronavirus required similar measures.
When the corona also came, And the basic principle is identification of the case, then contact tracing, quarantine. This was done fairly well in Kerala. Because our contact tracing, if you look at the figures, for one positive case, we have traced contacts up to 100 cases. People were housed in special centers meant for corona quarantined persons. And the home quarantined persons were very regularly monitored because we have a very well-functioning Panchayat Raj system, and in every ward there is a sanitation committee. We have ASHA workers, and the police personnel also were brought in. And the CM himself, Chief Minister himself, started a voluntary Sena, you see, an army of youngsters between 20 to 40 years. So all of them very regular, a three-member team regularly monitored the quarantined persons. And secondly, we also started what we call the Break the Chain campaign, which also was a great success. We said, of course, all these three principles, so washing your hands, keeping social distance, and thirdly, covering your mouth when you cough or sneeze. At the earlier stage, now we have made universal use of reusable mask now. We have introduced that. So therefore, you see that all these public health measures were brought in because of our maybe pre-existing learning experience in countering Nipah and then the flood from which we faced last 2 years. So, but then we know that we are not complacent. You see, we know that for that matter, this is a pandemic. Unless I used to say, with some maybe with some exaggeration, that unless the United States of America controls COVID in New York, Kerala will not be safe.
Mm-hmm. So today we're seeing like healthcare systems all across the world collapse because of insufficient funding and like austerity measures, like all around the place really. So could you talk about the Kerala's healthcare system and like what is the Kerala healthcare model been before this pandemic and how it has helped the state to like really survive this and overcome it?
No, we were always talking about Kerala model of health, maybe last half a century, maybe more than that. In fact, it's part of Kerala model of development. Kerala model of development can be defined as a high human development indices in spite of low economic status. Yeah. Even among Indian states, the Kerala's per capita income was low. Only very recently we are picking up. Others have defined the Kerala model of health that they say that it is good health at low cost, good health with social justice and equity. This is the general discussion of Kerala. Because you know that we have a fairly good, a robust system of public health system, starting from the primary health care centers up to Media College. And parallel with that, the missionaries started establishing hospitals in different parts of the Kerala. Most of them are doing family medicine and preventive medicine, not the corporate type of private setup. Of course, private hospitals also came into existence in Kerala. But you should understand that in late 1980s, Kerala started facing crisis. Because the longevity was increasing, so naturally, because longevity was increasing as a result of the good healthcare, naturally.
So here was a state which had successfully improved its healthcare, but as life expectancy increased, so did diseases. How did they manage that?
The public health system was not revamped or expanded enough to handle this increasing morbidity. It was stagnating, you see. And when it was stagnating, in that vacuum came the private hospitals in a big way. Of course, these corporate hospitals in Kerala are not that corporate if you compare with other Indian states.
Right.
Okay. But nevertheless, bigger hospitals, super specialty hospitals came. That I think that is a major contribution of Kerala to Indian polity. That there was we started what is called a People's Campaign for Decentralized Planning. And
People's Campaign for?
Decentralized planning.
Okay, decentralized planning.
Yeah. It was initiated by Dr. Thomas Isaac, who was the planning board member at that time. I was also a planning board member at that time, 96 government, 9R government. So we all started this decentralization campaign, and wherein the maximum decentralization was done in the public health institutions. From primary healthcare centers up to district hospitals were handed over to the local bodies. Understand? And moreover, there are three things happened in Kerala. One, there was an administrative decentralization. We decentralized financing also. Then 25% of the state budget is allocated to the local bodies. When a budget is presented, every panchayat knows how many money they are going to get. Okay, based upon a criteria. And thirdly, we also decentralized planning. Not only that we handed over the money, they can spend according to the local requirement. And of the total amount, 40% can be spent for social welfare, social services, including education and health. And suddenly there was a change in the public health system immediately. Because I can tell you, I was working as a neurosurgeon in Medical College at that time. I was in charge of the health allocation in the planning board. When I looked at the figures, I found that and up to that time, more than 70% of the money was going to the medical, not to the health services hospitals. You know, that changed completely.
Decentralized planning worked. All the wasteful expenditures and just bureaucracy stopped, and the process became much more efficient. This really surprised me. Okay, that's interesting that you bring that up, because when we look that up across the country, you'd expect every single state to be doing that, really. But I mean, of course, we're not seeing that in India. And like Kerala seems to be sort of an anomaly here. And that's why I wanted to focus on like what makes Kerala politics and I mean, like leftist politics in general that has allowed it to be so good. Also about decentralizing, the people have this idea in mind that it's only by like rigid state planning and like centralization of power that such measures can be taken and lives can be improved. But you bring about like a very interesting point about how decentralization actually improved people's lives in a material way.
You see that is a major game changer in Kerala. I want to put it on record. It's the game changer in Kerala. Because many so think that planning is a very sophisticated, expert assisted procedure and the local bodies plan it. Okay. And moreover, decentralization meaning decentralization of corruption.
Right.
All these arguments were there. But surprisingly, I can tell you from my experience as a public health activist that I was surprised how intelligent these local body functionaries, and they were very ably assisted by the experts also. See, grassroots democracy, what do you mean is it is a expert assisted grassroots democracy. See, so there was a lot of expertise available in Kerala. You know, that a large number of people coming retirement and coming back to the their homes have got expertise. So we at that time started what we call voluntary technical corps.
Experts working with people on ground worked splendidly.
And then in 2016, this government started what is called Ardhra Mission, by which the primary health care centers were converted into family health care centers. The PHCs were functioning only up to 2 o'clock. We have increased up to 6 o'clock. Number of doctors were increased from 2 to 3. Nurses from 3 to 4. All lab facilities were provided. All essential drugs were stocked. So that way, the public hospitals in Kerala improved tremendously. We had some advantage. Kerala had some advantage compared to other states in that our public health system was very robust.
Right. So that's what I want to focus on, because I mean, recently we've seen a lot of privatization happening across the board, really. That continues to happen even when we're dealing with the pandemic, and like we'd had the liberalization reforms, we had all of that. And it seems as if the states are not focusing on like public goods, on public services. And that's what I want to focus on. What do you think is specific about Kerala and the left parties here that has allowed it to like do this? What do you think, or like you have the experience, so could you relate the political and the healthcare part of this for me?
Of course, I purposefully did not mention about the ministry when I talked about 96, 2006, 2006 and 2016. All these were the left government. You see?
Yeah.
So during left government's regime, generally speaking, the healthcare facilities improves. And unfortunately, in Kerala, what happens is the government changes every 5 years. So
Now, Kerala again has a very unique situation wherein Every election cycle, the government changes between two coalitions, one which is led by communists and one which is led by neoliberals. And the interesting part here is that both of them follow socialist policies in Kerala. The left has managed to create a culture where if you're anything less than a socialist, you'll just not win. That's the dream.
And down below, even the right-wing people, they know that they are coming in closer with the people, and they cannot simply simply beat the left just by that some false allegation against the left.
Mhm.
They have to prove their work. You see, they have to do something concrete there. So the local body system, the decentralization system has sustained. The intervention of the left parties is obvious, not because I belong to the left stream of politics that I am saying this. If you look at objectively with statistics, you can see that.
Another important thing I talked to Dr. Iqbal was the culture in Kerala. Right. So you would say that it is like the left's ideology that allows it to do this, or would you say that it is like the Kerala culture that forces like every party to do this? Because I think both of these factors exist sort of there. What would you say on that?
Now, this is a very important question. Let us see what happened in Kerala during this epidemic. See, whenever we feel a crisis, the Kerala all come together, whether right or wrong. That may be part of our culture. You know that Sri Narayana Guru used to say that he used to say we should stand united. Now you look at this epidemic, this pandemic. The private sector came voluntarily to the Kerala government and offered all help. In fact, my friends in Janaswastha Abhiyan and others were asking, are you going to take over the private hospitals? You know that I have a friend, Dr. Fasil Ghafoor. I have to mention that. He's a leader of the private self-financing medical colleges, 17 of them. There are 22 private medical colleges. 5 are under the Christian community. They have a separate organization. So Fasil Ghafoor one morning telephoned me and told me that we are ready to give all our facilities for corona control. They have hostels, single room hostels, 200 per college, all of them, all the ICU unit, all the ventilators. And the Christian groups also followed. And you know that 2 medical colleges, one in Kannur and one in Wayanad, they offered all facilities and we have taken it over. Kannur, we have taken over, not by force. They asked us to take it over. And these 2 private hospitals are converted in, private medical colleges are converted into COVID hospitals now. So this is happening. So I think that Kerala has got a social capital. Irrespective of political movements, because of the tradition, our Renaissance movement, the ethos of the Renaissance movement which influence everybody. You know that there are Renaissance leaders in all communities, especially the downtrodden. That tradition is there. And of course, the tradition of the progressive movements is there. Because of that, in a time of crisis, everybody stand united. So at this point of time, if you ask me my views on private sector, I won't say. Because I am standing united with them to tide over the case. After that, we can have ideological differences and debates. But at this point of time, they are also helping us, you know. Yeah. So that social capital is here.
Because when one talks about like a lot of the audience on this show is like international as well. So when people think of like communist places or communist ruled states, really, they think that the government is like dictatorial and it takes over everything and that's how it gets the work done. But it's really interesting you say that the private capital and like the private institutions have actually just willingly allowed the government to control them because they just care about the people.
Yeah, that is there. But then you can see that the left sets the agenda in Kerala.
Right, exactly. Yeah.
Left sets the agenda in Kerala. That has to be considered.
Folks, don't worry. This is not opposite land. Private capital suddenly is not generous. It is the communist government which sets the agenda and all the private entities follow that. So like even in the developed countries, we're not seeing much like in the United States, they don't have universal healthcare and that's leading to a lot of poor and marginalized people dying because they just can't afford to go to the doctor and everything from like tests to like getting an ambulance, everything takes so much money that people just don't have that much savings. So I just want to ask you like this final thing. What do you think in the political realm must be done across the board internationally that allows the world to be better prepared for something like this that happens? Like if it comes again, it probably would, as scientists seem to be saying, and just improve the lives of the poor and the working class, really.
See, it has to be considered that health is a fundamental human right, and it should be protected by the state.
Yeah.
Even in the United States, if you look at the presidential elections,
Yeah.
there are 3 topics the presidential candidates debate every time. One is international affairs, second is domestic affairs, third is healthcare. And 30 million people in America are denied healthcare. I am not making an allegation as a leftist. This figure is given by Obama Barack.
Yeah.
So Obama came and he introduced the Obamacare
Yeah.
to 30 million people. And one of the promises of Trump was that he will dismantle it, but he could not. You should understand that. See, whenever you say America is turning right, many of the right policies he wanted to introduce, he could not. He could not even build a wall between Mexico and America.
I mean, that was a bluff.
So therefore, you see, I am sure that American people will take care of it. So I am sure that globally, there will be a relook at the way they are handling the health of their people. I am sure of it.
Right. I mean, we certainly hope they do, because I mean, Bernie Sanders, who was the only one who was advocating for universal healthcare, has just dropped out of the Democratic race, and because of the DNC and it's all of its shenanigans. And we just hope that whoever comes actually does implement universal healthcare, and even across the world, really. Yeah. Okay. Dr. Iqbal, thank you so much for coming. And I'm grateful to everyone who's doing their best handling this crisis. And thank you so much for that. And
let us
really,
we will tide over this crisis and learn a lot of lessons from it. And I think I am already started talking, at least from Kerala point of view, we are going to divide our history into 2, before Corona and after Corona.
Yeah, this was a significant point. Yeah. All right. Thank you so much. Is there any like social links, any place people can find you online?
Yeah, my email is there, WhatsApp is there. You can always contact me. Phone me up.
Yeah.
I will always phone back even if somebody unknown to me.
All right.
Dual 3 responsibility now. I am the chairperson of the medical board. I am now, today government appointed me as a committee to look at the educational issue. And then I am a planning board member. But nevertheless, I will definitely be in touch.
Thank you so much. All right, that was Dr. B. Iqbal. I would highly recommend that you watch the full interview, which I'll link down below in the description. If you want to learn anything about communist rule in Kerala or Kerala politics in general, and how such a communist rule has survived in a democratic country, definitely watch that interview. So, what can the world learn from this? How do you create a place where you care about the working class and have the ability to prevent any pandemics or any public health issues? Now, it is undeniable that wealth is needed for this. Kerala gets a lot of its wealth from remittance by skilled workers who are in the Middle East. And developed countries at least can do this. They have the resources. But even for developing countries or underdeveloped countries, all of these terms are not very well defined. But this was the result of Kerala's great public education system. This education system could create such educated and well-skilled workers. A strong public goods system, which includes healthcare, which includes education and all the infrastructure that supports all of it. This baseline already put it way ahead of other places. A decentralized healthcare system that listened to experts while following the needs of the people on the ground created such a system that it was responsive enough and efficient enough that it could really control the pandemic. With their experience in dealing with the Nipah virus, they were already kind of ready, and as soon as they saw the first 3 cases, they got to work. Roll the clip.
And this is their new hoax. But you know, we did something that's been pretty amazing. We're 15 people in this massive country. And because of the fact that we went early, we could have had a lot more than that. We will do everything in our power to keep the infection and those carrying the infection from entering our country. We have no choice. Whether it's the virus that we're talking about or many other public health threats, the Democrat policy of open borders is a direct threat to the health and well-being of all Americans. Now you see it with the coronavirus. You see it.
Tracing, testing, quarantining, and locking down the entire state. This worked, and they were successful. This kind of stuff you can only do when you're not interrupted by silly things like the fucking profit of the pharmaceutical industry. Kerala has now seemingly successfully contained the spread of the virus. And these developed countries could do the same tomorrow if they wanted to. They have the resources, they can follow the same path. What they lack is political will. You know who could change the situation? Workers owning the means of production. Alright, bye-bye. Oh hey, what a great video. I'll definitely be linking the full interview down below, so check that out. And thank you so much for subscribing. Thank you so much to Thought Slime for featuring this channel, and thank you to everyone who came from there. I loved reading your comments. You're also lovely and kind and fun, so keep commenting. And if you have any video ideas or something you want to watch, comment down below. And I think that's it. Alright, stay safe.